Thank you, Mayor Tory, and good afternoon. As of 1 o'clock this afternoon, there are 897 cases of COVID-19 in Toronto. This includes 727 confirmed cases and 170 probable cases. There are 86 cases that are hospitalized, 39 in intensive care units. Approximately 26% of these cases are attributed to community spread, and there have been about 11 COVID-19 deaths in total thus far. I am aware, however, of others that my team is currently gathering details on, and I will report on these numbers when the facts are confirmed. In the meantime, I extend my sincerest condolences to the family and friends of the individuals who have died thus far. Yesterday, we announced a number of measures to save lives, to protect and preserve the capacity of our healthcare system, and to minimize the social and economic impacts of COVID-19 on our city. I have received a number of questions around what yesterday's orders mean for our residents. Simply put, they mean the following. Anyone with COVID-19 who is not hospitalized is required to stay home and self-isolate for 14 days under the Health Protection and Promotion Act. Anyone with signs and symptoms of COVID-19 or waiting for their test results is required to stay home. Anyone who has had close contact with a person with COVID-19 or someone with signs and symptoms of COVID-19 is ordered to stay home for 14 days. If you have been ordered to stay home for 14 days, this means that you are not to go outside for any reason, except on a private balcony or an enclosed yard, if those are available. You are not to go for a walk or to go to the store to pick up essential supplies. Others will have to buy your groceries and supplies for you during the self-isolation period. To be clear, these requirements were already in place. The order, however, underscores how important it is for these people to stay in self-isolation, to protect our community. Under the local order, if you do not comply, you may be liable to a fine of up to $5,000 for each offense. We expect and hope that people will abide by the self-isolation that is required of them because they care about themselves, they care about their health, the health of their loved ones, and the health of their community. For everyone else in the City of Toronto, and I do mean every single person in Toronto, please stay home. Unless you are a healthcare or other essential worker, only leave your home to access healthcare or medication, to shop for groceries or other essentials, ideally only once per week, to walk your dog or to get some daily exercise. When you leave your home, you must maintain physical distancing of at least 2 meters from all other people at all times. If you live in the same household, you can go out and walk side by side, but only in groups of no more than 5, and not with people in your household who are sick or under self-isolation. After being out for these reasons, you should then return home as soon as possible. I also support the strong recommendations made by the Chief Medical Officer of Health for the province in respect of those over the age of 70, those with immune compromise or other medical conditions, for these individuals to stay home. I call on their friends, I call on their families and their neighbors to help make this staying home easy for them, as easy as possible for them, wherever you can. I continue to hear concerning reports of people ignoring our recommendations. Yesterday I learned that someone removed the barricades and signs that were put in place in the Sunnyside Park parking lot. We've just heard about that. And apparently both the park and the parking lot were full of people. This is nothing short of appalling. People are getting sick. People are dying in our city. Yet others think that it's okay to hang out with their friends in groups of people. This behavior is selfish, and it contributes to virus spread in our community, and it is not acceptable. It puts all of our health at risk. I know it was a beautiful day outside yesterday, and we all want to go outside and enjoy the nice weather. But I want to be clear. I need to be clear around what physical distancing means. What this means is that everyone needs to stay home as much as possible, except for the essential reasons I mentioned earlier. It does not mean driving to a park that is barricaded for closure and taking down the barricades. This is not physical distancing. Impromptu street parties, allowing children to play with each other on the street while the parents socialize with each other. This is not physical distancing. These are real examples that are happening in our community, and they are not acceptable, not at this time. I recognize that it is not easy to stay home, especially as the warmer weather approaches. However, staying home is exactly what we need to do. We know that this virus spreads from person to person. People moving around in our community, coming into close contact with one another, within 2 meters of each other, is exactly how COVID-19 spreads. If we cannot find a way, if we do not stay home as much as possible, more people will get sick and more will die in our city. We are regularly assessing this outbreak, and we will adjust our measures as needed as our situation changes. We are doing this to protect our city, to minimize the loss of life, to manage pressures on our healthcare system, and to get our city back as soon as we can. As I said yesterday, the spread of the virus and the amount of time that we have to keep up with all these measures, school closures, work closures, staying at home, all of this is in our hands. The sooner we comply with these measures, and the better we all comply with these measures, the sooner we can make it through this challenge together. Please, stay home, stay safe, and take care of each other.